Hi, my name is Sharonda Wallace, and today I will be providing prenatal education regarding maintaining a healthy pregnancy for a newly pregnant patient. Congratulations on your pregnancy. Today we'll discuss pregnancy appointments, nutrition, exercise, healthy weight gain, common pregnancy discomforts, and warning signs that should be reported to your healthcare provider. My name is Sharonda, and I will be taking care of you. Today, I will be discussing some patient education with you today. Do you mind verifying your name and date of birth? Great. So, again, congratulations on your pregnancy. During your pregnancy, I'm sure you know that you're going to have a lot of prenatal appointments. So, most patients are seen every 4 weeks until around 28 weeks of pregnancy, and every 2 weeks from 28 to 36 weeks, and weekly until delivery. So during those appointments, this allows your provider to check your weight, your blood pressure, your urine, and the fetal growth and heartbeat rate. There's also several laboratory tests and diagnostic procedures that are completed during the pregnancy. So in the first trimester, blood work is completed to determine what your blood type is, your RH factor, immunity status, and screen for infections. Around 11 to 14 weeks, some patients choose to have genetic screening for chromosomal abnormalities. So they typically do that between 11 and 14 weeks. And ultrasounds are typically done between 18 and 22 weeks to assess the anatomy of the fetal growth and development. So between 24 and 28 weeks, a glucose screening is done to make sure that you don't have gestational diabetes, and group B strep screening is performed around 35 and 37 weeks. So there's a lot of screenings and exams throughout your prenatal visits just to make sure that you and the baby are healthy. So with nutrition and vitamins, a healthy pregnancy requires a balanced diet that includes fruits, vegetables, whole grains, lean proteins, and low fat dairy products like milk and cheese. The protein sources that you want to include would be chicken, turkey, eggs, beans, and fish that is low in mercury. And you can also eat nuts. Calcium is good for you and the baby because it helps with build the baby's bones, and you want to get your calcium from foods like milk, yogurt, cheese, goat milk, and leafy green vegetables. Iron helps to prevent anemia, which is a common thing in pregnancies. So you want to try and get your iron from lean meats, spinach, beans, and fortified cereals like Kix or there's a few cereals on the market that are fortified. So also you should take your prenatal vitamins every day because it contains folic acid, and folic acid is important because it helps prevent neural tube defects, and Exercise is also encouraged during pregnancy to maintain a healthy pregnancy. So we recommend at least 150 minutes of moderate exercise every week, which is like 30 minutes a day for 5 days a week. So you could split it up. You could do it Monday through Friday, whatever you choose. We just want you to get some type of activity throughout your pregnancy. So activities such as walking and swimming. You could also do pregnancy yoga because these are all considered safe. What you don't want to do is contact sports like football. You want to do sports that don't present the risk of like falling, or you're not in extreme amounts of heat. So if you do feel like a dizziness or chest pains or shortness of breath or even contractions or start to have bleeding after exercising, we recommend that you stop and then contact your provider. So, but we do want you to get exercise, just a moderate amounts of that. You're not over strenuous on your body. So, I also want to talk about weight gain. So, the recommended weight gain is based on the patient's pre-pregnancy BMI. So, if you have a low BMI around 18.5, they expect you to gain between 28 and 40 pounds. If your BMI is moderate, maybe between 18.5 and 24, they expect you to gain about 25 to 35 pounds. If your BMI is a little bit higher, like 25 to 29, then the recommended weight is about 15 to 25. But if your BMI is 30 or greater, you're considered overweight or obese. So they don't want you to gain as much weight. They want you to gain around 11 to 20 pounds. And I understand that's hard to do, but if you create a healthy balance in your meals, eat smaller meals throughout the day, you can maintain that weight. And we can also provide resources to you to help with understanding that. Do you have any questions? Okay, great. So now I want to talk about some common complaints and relief measures that will help during pregnancy. So one of the most common complaints, especially early in pregnancy, is nausea and vomiting. So to decrease the symptoms, you want to, or reduce the symptoms, you want to eat small, frequent meals. Try to avoid greasy and spicy foods, and have some saltine crackers at the side of your bed before you get out of bed, because it'll decrease the nausea when you rise. Constipation is also very common, so you want to drink a lot of water and eat a high fiber diet, and try and exercise regularly so it helps your bowels move. Also, heartburn is another complication or complaint that a lot of women that are pregnancy have. So again, that's another thing that you want to eat smaller meals and avoid spicy foods. And also, after you eat, you want to remain upright for about an hour after eating to avoid heartburn. There's also some warning signs that would require immediate escalation to your healthcare provider. So if you notice vaginal bleeding, leaking from your vagina, severe headaches or vision changes, severe abdominal pain, persistent vomiting, if you see your face or your hands swollen. Also, if you notice that after later on in your pregnancy, if you notice that there's decreased fetal movement, you want to notify your provider immediately. So, to make sure I've explained everything clearly and that you understand everything that I've said today, can you tell me 3 things that you learned today about maintaining a healthy pregnancy? Very good. Is there any questions that you have for me today regarding anything I said or just in general? Okay, great. Well, thank you for your time. And again, congratulations on your pregnancy. And this concludes my demonstration of patient education on a healthy pregnancy. Thank you.